So my name is Lily Gutnik. I'm a breast surgical oncologist from the US at the University of Alabama at Birmingham. I am also the Assistant Program Director of Global Surgery and a member of the O'Neill Comprehensive Cancer Center. I am, in addition to obviously clinical care with breast cancer patients, I'm passionate about breast cancer disparities on a global scale, particularly women of African ancestry and in sub-Saharan Africa. But for me, breast cancer is really about women's empowerment through health. So when I take care of breast cancer patients anywhere in the world, I really want to not only, of course, treat and hopefully cure the cancer, but really make the women feel as whole as possible, as themselves as possible, and really very empowered. I came to the Paris Breast Center because I really wanted to learn more and experience what oncoplastic surgery really is like. In the US, it's a field that still is very much in its infancy. Right now, breast surgery and plastic surgery are very separate, although of course we work very well together, we work very closely together to provide the best care for the patients. But a true oncoplastic surgeon, in the sense that exists in countries like France and the UK and even parts of Germany, is something that is pretty unusual right now in the US. For me, it's something that I'm very interested in. I think it makes a lot of sense from the patient perspective. I think it helps the patient when it's just one surgeon taking care of the oncological part of the surgery as well as the reconstruction. It makes it a little easier for the patient. They have fewer follow-up appointments in terms of with different providers. In the US, where every visit requires a copay, saving an extra provider to see for the patient to see would also help them financially as well. And we know in the US, financial toxicity is a very important and unfortunate detrimental side effect of cancer care. And then from just even a technical perspective, it's something very interesting to me to be able to expand my skill set and perform some of the reconstructive aspects of the breast surgery. I was in Paris for about 5 weeks total. So even though 5 weeks seems like a very short amount of time, and it went by very quickly, I learned a lot. I filled 2 notebooks worth of notes. There was just a lot, both from the oncological aspect as well as from the reconstructive aspect. So for example, on the oncological aspect, a nipple-sparing mastectomy, the way I was seeing it done here in Paris is completely different than the way I was trained to do it. I was only trained in one approach, and that was as using Bovie electrocautery for the entire dissection. Whereas here it was done completely differently with tumescence and a scissors approach. The way I learned to even place incisions for nipple-sparing mastectomy was somewhat different than the way I learned here. And even the indications for nipple-sparing mastectomy, I believe, were much broader here in Paris than what I was trained in the US, which is wonderful. I mean, it really expanded my skill set and just expanded my indications and my approach of who I can offer this procedure to. From the reconstructive side as well, I definitely learned, like even in, for example, direct to implant is the most common form of reconstruction that I saw here in Paris, and it was something I very rarely saw in my training in the US. Most of the time, majority of the time, when a patient received implant-based reconstruction in the US, they would first start with a tissue expander at the time of mastectomy and later have a second procedure for exchange for implant. So even that just seems like a small nuance was really something fascinating and different, and again, and seemingly with excellent outcomes. In terms of other technique, like a latissimus dorsus flap, I've never seen one in the US other than for covering large chest wall defects and not for reconstructive technique. Obviously, lipofilling, though I've seen in the US, it was really more for just small kind of shaping here and there after an implant, filling defects. It was used for those kinds of scenarios, but not as a large portion of reconstruction techniques as I saw it here, which was again fascinating. Another thing I saw here that I've never seen before is the LICAP flap. Again, I saw about 2 or 3 of them in 5 weeks in Paris. I've never even heard of this in the US, and again, just seeing the results I thought were phenomenal, and seemingly the long-term outcomes are just as good as well. So again, in 5 weeks, I learned and saw things that I've never even heard of in the US and that were truly remarkable and valuable.